Marquez here, local chiropractor back pain relief center. We're coming to you from our Vineland office. Today we're here with Dr. Avakian. One of the cool things about working here is that we can adjust each other. So she just adjusted me a few minutes ago. You guys will see that one. We're going to take care of her now. Dr. Avakian is dealing with a little neck problem, and it's kind of going down her arm a little bit. So we're going to clear that up, and we're going to try to adjust everything just while we're here. All right, so let's go face down for me. So, with neck problems, we're seeing it more and more and more due to our technology. More people spending time on their computers, on their laptops, on their phones, and that head moving forward. And us being chiropractors, we bend over all day, and we face a lot of the same issues. So the first thing we're going to do with her, I'm going to try to loosen up some of these muscles first in order to give us a better adjustment to take out the muscle component of the issue. And so here we go. So I'm going to put a little pressure on some trigger points. And it could be a little tender, almost like a deep tissue massage type of feeling. Look this way for me 5 times. 1, 2, 3, 4, 5. Okay? And again, what we're doing, we're putting pressure on these upper trapezius muscles. And look this way for me. 1, 2. And I think it's a really common area for someone to feel some pain or discomfort. We're going to move to the other side. A little tender, right? Look this way for me. 1, 2, 3, 4, 5, and one last time. 1, side's tight. 2, 3, 4, 5. Good. The next thing we're going to do, I'm going to use an adjusting instrument, and the adjusting instrument helps realign the spine, helps decompress the spine by breaking up any adhesions that may have formed due to the repetitiveness of her job, of her lifestyle, things like that. Could be a little tender. What we're doing now, just loosening the muscles up a little bit, bringing some blood flow to the surface, makes the adjustment go a little easier. So since she has some neck pain, a lot of times neck pain or lower cervical pain also involves the upper thoracic, so we want to decompress those joints also. So our next move is an upper thoracic adjustment with Dr. Avakian. I can almost just use my thumbs to get it to move. All right, take a deep breath for me, and we'll let it all out. It's nice and light. Good. Good. All right, let's go on your back for me, face out. So now we're going to do a cervical manipulation, and the whole point of doing a manipulation is to decompress the joints. We get pain in our neck and pain down our arm because of compression of the bones on the joint or on the disc, which then can irritate the nerve. So I'll pull on her a little bit. Good. Okay. Come back up. Let's go back on your belly. Kind of feel everything a little more, make sure that we got it all to move. Why don't you look up for me? Good. Okay, let's do the other side. Up. Good. Back down. We're also going to address her low back, and I know this because I treat her every week. Even though she had a main complaint of her neck, we're going to get everything cleared up. What we do is check her leg. So this leg's shorter than, her right leg's shorter than her left leg. And that just means that we have a little bit of pelvic rotation. It's not that the actual leg's shorter, it's just rotated and it appears shorter. So we use a drop table in order to help realign it. Okay, still a little short, so we're going to do a manual manipulation. So lay on your left side, face me. Slippery pants and shirt on. Nice. Good. Okay, other side. Good. Okay. Back on your stomach. We're going to recheck her legs. And that looks good. All right, come on up. All right, so thanks for watching. That's a manipulation. This is Dr. Avakian. Make sure you come in and see her. She's here on Mondays, Tuesdays, and Thursdays. She's my chiropractor. I have all the confidence in the world in her. She enables me to function and feel just a little better. All right, guys, thanks for watching.